Good morning, and thank you all for being here. As Taylor said, I'm Marcia Devon, BART Deputy General Manager, and we're here this morning to discuss a difficult topic. Last year, there were 14 incidents of a person hit or nearly hit by a train here in the BART system. That was up from 6 from the previous year. This year, that number already stands at 6, and it's only April. Because even one of these incidents is one too many, BART created a task force last December to explore options to address the issue of people in crisis who may be contemplating suicide at our stations. Our first step was to reach out to regional mental health experts and to look at what other transit agencies have done.
3-car train for Fremont in 5 minutes.
The Bay Area Suicide and Crisis Intervention Alliance is an incredible partnership of municipal and county resources. They guided our development of the BART Suicide Prevention and Awareness campaign that we're launching today. The Alliance has provided an enormous amount of support, which has been essential to our efforts. Initially, we will be placing signs across from the platform with the message, "Suicide is not the route," and includes the toll-free number to the National Suicide Lifeline. You can see an example here in this station behind me. The toll-free number, administered by the federal government, redirects calls based on the caller's area code to the appropriate local agency for 24/7 free and confidential help. Our data shows that the problem isn't limited to any specific area, so the signs will be rotated throughout the system. Additionally, we will be distributing Lifeline wallet cards provided by the Substance Abuse Mental Health Services Administration in all of our stations. Another important element is the training of frontline staff on how to recognize and help a person in crisis.
4-car train for Richmond in 7 minutes.
The Alliance will be assisting BART with this training. Longer-term ideas include printing the Suicide Lifeline number on BART paper tickets and looking into the feasibility of and funding for platform screen doors. We will continue to work with the experts in mental health community and cannot thank them enough for their assistance in helping us get to this point. I now would like to introduce BART Board Member Director Rebecca Salzman, who represents this station.
Thank you, and I'm very grateful to the Alliance for their leadership on this topic, and I'm happy to see BART take this very important first step. We decided to launch the campaign here today at the downtown Berkeley station because of its proximity to the UC Berkeley campus. Last November, we had a fatality involving a Cal student in crisis.
3-car train for Fremont in 2 minutes.
It's a tragedy that impacts our community, our riders, and BART employees. Making the Suicide Lifeline number available in our stations may prevent a tragedy and may be the first step to getting someone help. Here to discuss the importance of suicide awareness and prevention is Nancy Salome, Executive Director of Alameda County Crisis Support Service.
Thank you. Good morning. Crisis Support Services of Alameda County answers the crisis number 1-800-273-TALK from anywhere in our county. And one of our specially trained phone counselors will answer that suicide prevention crisis line. Likewise, calls from elsewhere in the BART system, Contra Costa, San Francisco, and San Mateo counties, our sister agencies will respond to your crisis the same as we do in Alameda County. These calls are answered by the Contra Costa Crisis Center, the San Francisco Suicide Prevention, and Star Vista Crisis Center in San Mateo County. Here with me today is Nargis Dillon from Star Vista Crisis Center in San Mateo, and two of my staff members, Mercedes Coleman and Chris Rita. Suicide is the 10th leading cause of death in the United States. It claims 650 to 700 lives each year in the Bay Area. and suicide from fixed rail systems is an increasing concern.
Three-car Fremont train now approaching platform 2.
Is an increasing concern here at BART, on Caltrain, and other systems. Lives are lost in a most tragic manner before witnesses and first responders. The subsequent grief is devastating and can overwhelm family and friends that are left behind. One death brings endless wounds and impacts all of us deeply.
Three-car Fremont train now boarding platform 2.
We want to thank BART for launching this campaign and in highlighting local suicide prevention resources. In addition to the poster you see, BART is publicizing the crisis number on other materials, as well as training station agents and security staff to better recognize individuals who are at risk for suicide. I should mention that BART initiated this collaborative effort. Many of us have had years of frustrating interactions advocating suicide prevention measures before transportation agencies, so it is truly heartening to see BART take these first steps. As important as this first step is,
Five-car train for San Francisco Millbrae in 7 minutes. Three-car train for Fremont in 14 minutes.
as important as this first step is, we know much more is needed. Over 40 years of suicide prevention research has established that restricting easy access to lethal means is a proven, effective way to reduce suicide deaths. We know that, and many as BART recognize, that a system to restrict access will be needed at the BART stations. We look forward to working with BART to design and implement such a system. And finally, and most important, I want everybody to please remember, if you or someone you know is suicidal or in crisis, you're not alone. Please call us. We're here 24/7 at 800-273-TALK. And now I have the pleasure to introduce Kevin Hines, a suicide survivor, a mental health advocate, and a dear friend and colleague. Welcome.
Thank you very much, Nancy, and thank you to all who are here today to witness this moment and this fight for some change. Are you okay? Is something wrong? Can I help you? Those were the only words that I desperately needed to hear. Standing atop the Golden Gate Bridge walkway, crying hysterically, leaning over that 4-foot-nothing rail, peering down to the looming waters below me, before I stepped back, ran forward, and catapulted myself into free fall off of that bridge. Here is the point, the millisecond I hit free fall. It was an instant regret. At that moment, I knew I had just made the single worst mistake of my entire life. And at that moment, I thought it was too late. People in suicidal crisis are most likely in an irrational, often psychotic, or distorted state of mind. If given the opportunity to voice their clear and present emotional pain, they are most likely given that voice without judgment, without embarrassment. If given time and a listening ear, they can be helped, they can be guided.
Please help us keep the system clean and safe. Just a friendly reminder, there's no eating, drinking, smoking, or playing loud music while on the trains or in the paid areas of the BART system. All violators are subject to a fine of $250. Thank you.
They can be guided toward hope and treatment. They can find the will to live. They can go on. They can keep on keeping on, as they say. BART is doing just that for its passengers and passersby. The evidence is clear. Call lines, available in the most drastic of critical emotional times, have saved countless lives. We do know, and we are also clear, that this is not the only answer. Like Nancy said, reduction of access to lethal means will save lives. But this is a commendable first step by BART, a step that they came to almost immediately, unlike places like the Golden Gate Bridge, who for 80 years remained silent and complacent with death by suicide being the norm. BART has stepped in and has decisively said, we are here to help. We are here to guide all of those in need to someone to talk to so they can guide themselves on the right path. I now look directly to you here today. I'm talking to the individuals here present and watching from home. Those of you who ride BART daily or know someone who does that may be contemplating dying by suicide, you are not alone, and no matter the epic emotional pain you are in, if someone you care for is right now thinking of suicide, it is not a way out. It does not have the ability to end the pain. It will only leave an infamous wake of destruction in your path. It will only breed that very pain to growing in all of those who love you. Suicide is not the answer to any problem. It never has been, and it never will be. If you're in danger of harming yourself, if you are at risk of dying by suicide like I was, please call If you are at risk of dying by suicide, like Nancy said, please call 1-800-273-8255. 1-800-273-8255. You could save the life of someone you love. You could save your own life. I wish I knew that number existed when I went off that rail. Thank you very much.
Thank you so very much. Our in-house crisis intervention specialist, Armando Sandoval, and the head of our system safety department, Jeff Lau, are here and available to answer questions along with the experts you heard from today. Thank you.